Hello everyone, I'm Brandy Carruthers. I'm in the group with Jill and our discussion is on DTC Genetic Testing and our group is against it. We chose Provision 1 of the ANA Code of Ethics 1.3 where the nurse will respect the worth, dignity, and rights of all patients irrespective of the nature of the health problem. According to ScienceDirect.com, risk exists for social stigmatization, discrimination by insurers, employers, educational institution, and there is a risk for psychological harm from DTC genetic testing. They also state that employers and insurers may be tempted to use low-cost predictive tests to identify individuals genetically predisposed to develop certain cancers, diabetes, coronary artery disease, Alzheimer's disease, or schizophrenia to screen out those at risk and avoid anticipated high healthcare costs. Although many healthcare organizations have set out to protect patients from discrimination, it is near impossible to do so all the time. Provision 2, primacy of the patient's interest, states that the nurse's primary commitment is the recipient of nursing and healthcare services. The patient, whether the recipient is an individual, family, community, or group, if a patient is using a home genetic kit, there is no way that a trained health professional, such as a nurse, would be able to help assist in a care plan for that patient. Provision 3, protection of privacy and confidentiality. According to HHS.gov, genetic testing is covered under HIPAA. With that being said, there's no way for companies to be, with home genetic tests, to be monitored for that protection of privacy. Provision 6, influence of the environment. ScienceDirect.com states that nurses can influence patients positively by practicing in a moral and ethical environment that promotes and affirms client values related to human dignity, well-being, respect, health, and independence. When individuals use a home genetic test kit, they may be in a more comfortable setting for themselves, but they don't have the support and help that would be available to do so in a healthcare setting. Nurses have a vital role in ensuring patients receive the highest quality care in an ever-changing world of genetics. We must assess and collaborate with other healthcare professionals as stated in Provision 8 and 9, which is bypassed when a person decides to use a DTC home genetic kit. ScienceDirect.com summarizes our team's argument stating, in order for patients to receive quality genetic health care, nurses must be sensitive to patients' needs regarding confidentiality, the right for self-determination, value systems, and discrimination issues. Due to the many issues still remaining with genetic testing, our group still remains against it. Thank you.